Come in.
Hi, Mr. Gonzalez. How are you doing? Performing hand hygiene.
Good, yourself?
I'm good, thank you. My name's Yvette. I'm your nurse today. I'm here to do a peripheral vascular assessment. Is that okay?
Yes.
Okay, before we begin, I'm going to ask you a few questions. Have you ever had problems with varicose veins?
No.
Have you ever had it where you have pain in your calves or thighs when walking but stops when you rest?
No.
Okay, we're going to go ahead and get started. I'm going to get a little close here just so I'm at eye level with you here, okay? I'm going to just get a little close here. Okay, could you hold out your arms for me? I'm just inspecting, looking at skin color. Skin color is nice and tan, you know, other than some tan lines here and these lovely tattoos. I'm going to go ahead and turn your arm over, just looking for any lesions or any edema as well, which I see none. And then I'm going to go ahead and touch with the back of my hands to feel your skin color, to feel your skin temperature. And it is warm and dry. I don't see any sign of cyanosis or pallor on your skin as well. I'm going to go ahead and look at your hands out. I'm going to look at your nail beds on each hand, which this is nice and pink, and I'm going to go ahead and test for capillary refill on each finger, on both hands, and observing the nail beds as well on this hand. And capillary refill was less than 2 seconds on both sides. I'm going to go ahead and turn your hands over, and I'm feeling for a radial pulse on both sides to see if they're symmetrical, which they are. And I'm going to take note of the pulse's rate, rhythm, and force. Force is 2+, which is normal. Rhythm is regular, and rate is normal as well. Now I'm going to go ahead and move up here into your brachial pulse. Which is a little harder to find. There we go. I'm also noticing rate, rhythm, and force. Force is 2+. Rhythm is also regular, and rate is at normal limits as well. Now I'm going to go ahead and move down to your legs. Here. I'm going to ask you to put them up here. And I'm looking at the skin color as well. I don't see any signs of lesions or anything like that. Legs are nice and tan as well, appropriate. And I also do not see any venous pattern on both sides, looking for varicose veins, which you would typically see on the bottom around the calf area. I see even hair distribution as well. I'm going to go ahead and touch with the back of my hands, assessing for skin temperature all the way up to the to the feet, the top of the foot, and temperature is warm as well. I don't see any tibial edema as well. And then I'm going to go ahead and look at the nail beds of your toes, which are nice and pink as well. And I'm going to go ahead and press down for capillary refill, which are less than 2 seconds, which is good. Now we're going to go ahead and look at the other side. Look at the nail beds, nice and pink, and press for capillary refill, less than 2 seconds. Now I'm going to go ahead and check the dorsalis pedis pulse right here at the top of the foot. And I'm looking for rate, rhythm, and force. Force is 2+, rhythm is regular, and rate is also normal. Now I'm going to go ahead and look at the posterior tibialis pulse. Okay, I found both, and I'm also assessing rate, rhythm, and force. Force is 2+ as well. Rhythm is regular. Rate is normal within limits. All right, Mr. Gonzalez, thank you so much. I appreciate it.